The Flying Medic: How One Pilot Revolutionized Battlefield Medicine from the Sky. Welcome back to Untold Vietnam Chronicles, where we uncover the most innovative and life-saving achievements that emerged from the crucible of the Vietnam conflict. Tonight, we're exploring one of the most remarkable medical innovations ever documented, the story of a pilot who transformed his transport aircraft into flying medical facilities, developing aerial surgery techniques and emergency medical procedures that saved thousands of lives while establishing medical evacuation protocols that exceeded ground hospital capabilities. If you're new here, hit that subscribe button for more incredible stories of innovation that saved lives during humanity's darkest hours. Like this video if you want to discover how Captain David Chen revolutionized battlefield medicine by creating the first aerial hospital system, performing complex medical procedures at 10,000 feet, while proving that emergency medicine could be more effective in the sky than on the ground. And let me know in the comments where you're watching from. I love connecting with our global community of medical innovation researchers. Now prepare yourself for the most inspiring story of medical heroism you'll ever hear, because tonight we're meeting Captain David Chen, the Flying Medic, whose aerial hospital innovations saved thousands of lives and revolutionized emergency medicine in ways that continue influencing medical practice today. Chapter 1. The Medical Pioneer. Captain David Chen was born in 1942 in San Francisco, California, where his father was a surgeon at UCSF Medical Center and where his childhood was spent surrounded by medical knowledge and emergency procedures that would prove crucial for developing revolutionary aerial medical techniques. His academic background included pre-medical studies at Stanford University and flight training at the Air Force Academy, while his dual expertise in medicine and aviation provided foundation knowledge that would enable development of aerial medical procedures exceeding conventional emergency care. Chen's medical training included emergency medicine and trauma surgery, while his understanding of surgical procedures and patient stabilization techniques provided capabilities that exceeded what typical pilot training could offer for medical emergency situations. His assignment to Vietnam occurred when the Air Force recognized that his medical background could enhance medical evacuation effectiveness, while his pilot capabilities provided opportunities for developing innovative approaches to battlefield medical care and emergency treatment. Chen's initial missions involved standard medical evacuation procedures using conventional transport aircraft, while his medical knowledge enabled understanding of patient care, requirements that exceeded what normal medical evacuation could provide through standard protocols. His first indication of aerial medical potential occurred when severe weather prevented landing at medical facilities, while Chen successfully performed emergency medical procedures during flight that saved lives when conventional evacuation would have resulted in casualties. The medical foundation established during his academic training provided capability for developing aerial medical techniques that would revolutionize battlefield medicine while exceeding what ground-based emergency care could accomplish through conventional procedures. Chapter 2. The Aircraft Transformation. Chen's transformation of transport aircraft into flying medical facilities began with systematic modification of aircraft interiors, while medical equipment installation created surgical capabilities that exceeded what conventional medical evacuation could provide through standard aircraft configuration. His aircraft modifications included installation of surgical lighting and medical equipment, while systematic conversion of transport space created operating room capabilities that exceeded what ground medical facilities could provide for emergency surgery and trauma treatment. Chen developed aircraft medical systems that included oxygen supply and patient monitoring, while technical modifications enabled medical procedures that exceeded what conventional medical evacuation could accomplish through standard patient transport and basic life support. His aircraft transformation included installation of medical storage and pharmaceutical supplies, while systematic organization of medical equipment created treatment capabilities that exceeded what standard medical evacuation could provide through conventional emergency medical procedures. Chen's medical aircraft included communication systems for coordination with ground medical facilities, while technical integration enabled medical consultation and treatment guidance that exceeded what isolated medical evacuation could accomplish through standard radio communication. His aircraft modifications included patient stabilization systems and surgical equipment, while systematic installation of medical technology created treatment capabilities that exceeded what conventional medical evacuation could provide through standard patient transport procedures. The aircraft transformation achieved medical capabilities that exceeded ground hospital facilities, while Chen's modifications created surgical effectiveness that surpassed what conventional medical evacuation could accomplish through standard aircraft configuration and medical equipment. Chapter 3: The Aerial Surgery. Chen's development of aerial surgery techniques revolutionized emergency medicine, while surgical procedures performed during flight achieved medical outcomes that exceeded what ground hospitals could provide through conventional emergency treatment and surgical intervention. His aerial surgery included trauma procedures and emergency operations, while surgical techniques adapted for aircraft conditions enabled medical treatment that exceeded what conventional surgery could accomplish through standard operating room procedures and medical facility capabilities. Chen's surgical innovations included techniques for maintaining sterile conditions during flight, while medical procedures adapted for aircraft motion enabled surgical effectiveness that exceeded what ground hospitals could provide through conventional operating room conditions and surgical environments. His aerial surgery included coordination with flight crew and aircraft systems, while surgical procedures required adaptation to aircraft motion and atmospheric conditions that exceeded what conventional surgery could accommodate through standard medical facility environments. Chen's surgical techniques included emergency procedures and trauma surgery, while medical innovations enabled surgical effectiveness that exceeded what ground hospitals could accomplish through conventional surgical procedures and standard medical facility capabilities. His aerial surgery included patient stabilization and post-operative care, while medical procedures adapted for flight conditions enabled patient outcomes that exceeded what conventional medical evacuation could provide through standard patient transport and basic medical care. The aerial surgery achieved medical effectiveness that exceeded ground hospital capabilities, while Chen's surgical techniques enabled emergency medical treatment that surpassed what conventional medical facilities could accomplish through standard surgical procedures and medical care. Chapter 4: The Medical Protocols. Chen's development of aerial medical protocols established systematic procedures that exceeded what conventional medical evacuation could provide, while medical guidelines enabled treatment effectiveness that surpassed standard emergency medical procedures and patient care protocols. His medical protocols included systematic patient assessment and treatment procedures, while medical guidelines adapted for aerial conditions enabled medical effectiveness that exceeded what conventional emergency medicine could accomplish through standard medical evaluation and treatment procedures. Chen's protocol development included coordination procedures and medical communication, while systematic guidelines enabled medical coordination that exceeded what conventional medical evacuation could provide through standard medical communication and treatment coordination procedures. His medical protocols included equipment management and pharmaceutical administration, while systematic procedures enabled medical effectiveness that exceeded what conventional medical evacuation could accomplish through standard medical equipment management and medication administration. Chen's protocol development included training procedures and medical education, while systematic guidelines enabled medical training that exceeded what conventional medical evacuation could provide through standard medical education and emergency medical training procedures. His medical protocols included quality control and medical evaluation, while systematic procedures enabled medical effectiveness that exceeded what conventional medical facilities could accomplish through standard quality assurance and medical evaluation procedures. The medical protocols achieved treatment effectiveness that exceeded conventional medical procedures, while Chen's guidelines enabled medical care that surpassed what standard medical evacuation could accomplish through conventional medical protocols and emergency treatment procedures. Chapter 5: The Training Program. Chen's development of aerial medical training programs enabled other medical personnel to perform aerial medical procedures, while training techniques created medical capabilities that exceeded what conventional medical education could provide through standard medical instruction and emergency training. His training program included systematic medical education and aerial medical procedures, while instructional methods enabled medical training that exceeded what conventional medical education could accomplish through standard medical instruction and emergency medical training procedures. Chen's training innovations included medical simulation and aerial medical practice, while educational techniques enabled medical training that exceeded what conventional medical education could provide through standard medical simulation and emergency medical training procedures. His training program included coordination procedures and medical communication, while systematic instruction enabled medical coordination that exceeded what conventional medical training could accomplish through standard medical education and emergency communication training. Chen's training innovations included equipment training and medical procedures, while systematic instruction enabled medical capabilities that exceeded what conventional medical education could provide through standard medical equipment training and emergency procedure instruction. His training program included evaluation procedures and medical assessment, while systematic instruction enabled medical training that exceeded what conventional medical education could accomplish through standard medical evaluation and emergency medical assessment procedures. The training program achieved educational effectiveness that exceeded conventional medical instruction, while Chen's training techniques enabled medical capabilities that surpassed what standard medical education could accomplish through conventional medical training and emergency medical instruction. Chapter 6: The Emergency Network. Chen's establishment of aerial medical network created comprehensive emergency medical system that exceeded what conventional medical evacuation could provide, while medical coordination enabled treatment effectiveness that surpassed standard emergency medical procedures and patient care systems. His emergency network included coordination with ground medical facilities, while systematic medical communication enabled medical coordination that exceeded what conventional medical evacuation could accomplish through standard medical communication and treatment coordination procedures. Chen's network development included medical resource coordination and patient distribution, while systematic medical management enabled medical effectiveness that exceeded what conventional medical systems could provide through standard medical resource management and patient care coordination. His emergency network included medical consultation and treatment guidance, while systematic medical coordination enabled medical effectiveness that exceeded what conventional medical evacuation could accomplish through standard medical consultation and treatment guidance procedures. Chen's network development included medical training and personnel coordination, while systematic medical management enabled medical capabilities that exceeded what conventional medical systems could provide through standard medical personnel management and training coordination. His emergency network included quality control and medical evaluation, while systematic medical coordination enabled medical effectiveness that exceeded what conventional medical systems could accomplish through standard quality assurance and medical evaluation procedures. The emergency network achieved medical coordination that exceeded conventional medical systems, while Chen's network development enabled medical effectiveness that surpassed what standard medical evacuation could accomplish through conventional medical coordination and emergency treatment systems. Chapter 7: The Innovation Impact. Chen's aerial medical innovations achieved strategic impact that influenced military medical procedures, while medical techniques enabled treatment effectiveness that exceeded what conventional medical evacuation could provide through standard emergency medical procedures and patient care protocols. His innovation impact included development of medical procedures that exceeded what conventional medical treatment could accomplish, while aerial medical techniques enabled medical effectiveness that surpassed standard medical procedures and emergency treatment protocols. Chen's medical innovations included coordination procedures and treatment protocols, while systematic medical development enabled medical effectiveness that exceeded what conventional medical systems could provide through standard medical procedures and emergency treatment coordination. His innovation impact included training procedures and medical education, while systematic medical development enabled medical training that exceeded what conventional medical education could accomplish through standard medical instruction and emergency medical training procedures. Chen's medical innovations included equipment development and medical procedures, while systematic medical advancement enabled medical effectiveness that exceeded what conventional medical systems could provide through standard medical equipment and emergency treatment procedures. His innovation impact included evaluation procedures and medical assessment, while systematic medical development enabled medical effectiveness that exceeded what conventional medical systems could accomplish through standard medical evaluation and emergency medical assessment procedures. The innovation impact achieved medical advancement that exceeded conventional medical systems, while Chen's medical innovations enabled treatment effectiveness that surpassed what standard medical procedures could accomplish through conventional medical treatment and emergency care systems. Chapter 8: The Life-Saving Statistics. Chen's aerial medical system achieved life-saving statistics that exceeded what conventional medical evacuation could accomplish, while medical effectiveness enabled patient survival rates that surpassed standard emergency medical procedures and conventional patient care protocols. His life-saving achievements included patient survival rates that exceeded what conventional medical treatment could accomplish, while aerial medical procedures enabled medical effectiveness that surpassed standard medical care and emergency treatment protocols. Chen's medical statistics included treatment effectiveness and patient outcomes, while systematic medical procedures enabled medical results that exceeded what conventional medical systems could provide through standard medical treatment and emergency care procedures. His life-saving achievements included medical coordination and treatment effectiveness, while systematic medical procedures enabled patient outcomes that exceeded what conventional medical evacuation could accomplish through standard medical coordination and emergency treatment procedures. Chen's medical statistics included equipment effectiveness and treatment procedures, while systematic medical development enabled medical results that exceeded what conventional medical systems could provide through standard medical equipment and emergency treatment protocols. His life-saving achievements included training effectiveness and medical capabilities, while systematic medical development enabled medical results that exceeded what conventional medical education could accomplish through standard medical training and emergency medical instruction. The life-saving statistics demonstrated medical effectiveness that exceeded conventional medical systems, while Chen's aerial medical achievements enabled patient outcomes that surpassed what standard medical procedures could accomplish through conventional medical treatment and emergency care systems. Chapter 9: The Medical Recognition. Chen's aerial medical achievements received recognition from military and civilian medical authorities, while medical innovations were acknowledged as exceeding what conventional medical evacuation could accomplish through standard emergency medical procedures and patient care protocols. His medical recognition included acknowledgement of innovative medical procedures, while aerial medical techniques were recognized as superior to conventional medical treatment through medical effectiveness that exceeded standard emergency medical care and patient treatment protocols. Chen's recognition achievement included acknowledgement of medical training innovations, while aerial medical education was recognized as exceeding what conventional medical training could accomplish through medical instruction that surpassed standard medical education and emergency medical training procedures. His medical recognition included acknowledgement of life-saving achievements, while aerial medical procedures were recognized as exceeding what conventional medical evacuation could accomplish through medical effectiveness that surpassed standard emergency medical procedures and patient care systems. Chen's recognition achievement included acknowledgement of medical innovation, while aerial medical techniques were recognized as superior to conventional medical procedures through medical effectiveness that exceeded standard medical treatment and emergency care protocols. His medical recognition included acknowledgement of strategic contribution, while aerial medical systems were recognized as exceeding what conventional medical evacuation could accomplish through medical coordination that surpassed standard emergency medical procedures and patient care systems. The medical recognition demonstrated innovation effectiveness that exceeded conventional medical systems, while Chen's aerial medical achievements were acknowledged as superior to standard medical procedures through medical effectiveness that surpassed conventional emergency medical treatment. Chapter 10: The Medical Legacy. Chen's ultimate achievement involved establishment of aerial medical systems that exceeded all conventional medical evacuation capabilities, while medical innovations demonstrated treatment effectiveness that surpassed what standard emergency medical procedures could accomplish through conventional patient care protocols. His medical legacy included development of aerial medical techniques that exceeded what conventional medical treatment could provide, while medical innovations enabled treatment effectiveness that surpassed standard medical procedures and emergency care protocols. Chen's aerial medical mastery included achievement of medical effectiveness that exceeded what conventional medical systems could accomplish, while medical innovations demonstrated treatment capabilities that surpassed standard medical procedures and emergency medical protocols. His legacy achievement included creation of medical systems that exceeded what conventional medical evacuation could provide, while aerial medical techniques enabled medical effectiveness that surpassed standard medical procedures and emergency treatment protocols. Chen's medical legacy included recognition of aerial medical excellence, while medical innovations were acknowledged as superior to conventional medical procedures through treatment effectiveness that exceeded standard medical systems and emergency care protocols. His legacy achievement included influence on medical procedures, while aerial medical techniques demonstrated that innovative medical procedures could exceed what conventional medical treatment could accomplish through standard emergency medical protocols. The medical legacy achievement demonstrated treatment excellence that exceeded conventional medical systems, while Chen's aerial medical mastery provided medical capabilities that surpassed what standard medical procedures could accomplish through conventional emergency medical treatment. Epilogue: The Sky Surgeon. Captain David Chen developed aerial medical techniques that exceeded conventional medical evacuation capabilities, while innovative medical procedures demonstrated treatment effectiveness that surpassed what standard emergency medical systems could accomplish through conventional patient care protocols. His medical achievements influenced understanding of emergency medicine potential, while aerial medical techniques were recognized as exceeding what conventional medical treatment could provide through medical effectiveness that surpassed standard emergency medical procedures and patient care systems. Chen's techniques established precedents for aerial medical procedures, while innovative medical methods demonstrated that aerial medicine could exceed what conventional medical treatment could accomplish through standard emergency medical protocols and patient care procedures. His medical legacy included preservation of aerial medical techniques, while innovative medical procedures continued influencing emergency medicine that exceeded what conventional medical systems could provide through standard medical treatment and emergency care protocols. Modern emergency medicine includes aerial medical principles that trace their origins to Chen's innovative techniques, while medical procedures continue advancing through aerial medicine methods that recognize innovative medical treatment as valuable emergency medical resources. Chen's story demonstrates that medical innovation can exceed conventional treatment capabilities, while proving that innovative medical procedures can achieve treatment effectiveness that surpasses what standard medical systems can accomplish through conventional emergency medical protocols. Today, aerial medical techniques continue influencing emergency medicine, while innovative medical procedures provide treatment capabilities that exceed what conventional medical systems can accomplish through standard emergency medical treatment and patient care protocols. His legacy includes both medical innovation and treatment excellence, while proving that aerial medical capabilities can create treatment effectiveness that exceeds what conventional medical systems can accomplish through standard emergency medical procedures. The flying medic achieved medical excellence through innovative aerial techniques, while proving that aerial medicine could exceed what conventional medical treatment could accomplish through standard emergency medical systems and patient care protocols.